Good evening and welcome to the Chronic Wasting Disease Public Information Session. This meeting will include a live Q&A session with Tina Johansson for participants. Submit your questions in the comment thread throughout the meeting and they will be addressed live at the end.
Good evening, everyone. So why are we concerned about chronic wasting disease? Well, hunting in Georgia is a big business. White-tailed deer are actually the state mammal of Georgia. And because of deer, there's about a $1.6 billion economic impact to the state of Georgia. Deer hunting in Georgia supports over 150,000 jobs. We have over 600,000 hunters who participate. It generates over $23 million in matching federal Pittman-Robertson funds each year. And we harvest about 280,000 deer every year in Georgia. So what is this chronic wasting disease? It's a degenerative neurological disease of members of the deer family. It affects deer, elk, and moose. It's caused by an infectious, misshapen prion protein. Not a virus, not a bacteria. The incubation period in white-tailed deer is about 18 to 30 months, but 100% of deer that get infected will die. So what does this disease look like? It's important to remember that infected deer look perfectly normal until the final few months of the disease. This incubation period is so long that most deer that contract CWD will die of some other cause or be killed by a hunter before they become symptomatic. However, those infected deer will be shedding infectious prions, contaminating the environment and exposing other deer that they come into contact with before those symptoms do appear. You're not going to see a whole lot of sick deer out on the landscape until the prevalence is high, meaning that a lot of deer are infected. When you do see symptoms, you're going to see the dramatic weight loss, the wasting that gives it its name. You may see drooping heads and ears, drooling, abnormal behavior. They may be slow to react like a normal deer would. They may look like they're just not aware of what's going on around them. But again, these symptoms do not appear until the final weeks, months, or even years after the infection, the final stages of the disease. That is why this routine surveillance we do is needed to catch it when the prevalence is low. We cannot just look for sick deer. We must routinely test apparently healthy deer. So how does it spread? Well, the number one way that CWD has and continues to spread long distances is through the movement of live deer. Once it's in an area and it's become established, the primary concern is direct contact among deer within social groups. It appears to take repeated exposures to an infected animal before other animals become infected. This deer-to-deer contact involves bodily fluids, saliva, urine, and feces. They can also be infected in an indirect way. Discarded infectious carcass parts, particularly brains and spinal columns, can contaminate the environment. These bodily fluids that an infected deer is naturally going to shed may also deposit infectious prions into the environment. This is why it's so important to not move live deer, which has been banned in Georgia for quite some time, or discard carcass parts out on the landscape far away from where the deer was originally taken. What if we did nothing? This disease, unlike others, it doesn't come and go as survivors develop immunity. CWD steadily spreads if it's not managed. You can think of other disease courses as something like a roller coaster. The disease increases over time. It may have a dramatic impact on the deer herd. Then the deer herd slowly recovers as animals develop immunity. CWD is more like an escalator. It starts slow, but then steadily goes upward. Once it's established in a wild population, eradication is not feasible. A larger geographic area will become contaminated as prevalence, the number of deer infected, increases over time. We are the 36th state to find CWD within our borders. It also occurs in 5 Canadian provinces. In this map, Gray counties indicate where the disease occurs in wild deer, elk, or moose. The dots are the locations of contaminated captive facilities. Those dark gray counties that you see out in Colorado are where it was first discovered and described back in the late 1960s. Since then, you can see it has spread far north into Canada and has slowly made its way into the eastern United States. If you zoom in on the southeast, you'll see that several of our neighboring states, in fact, all of them except South Carolina, have discovered CWD within their borders, both in captive deer and in wild populations. I want to first emphasize that CWD has not been shown to infect people. No cases of CWD have ever been documented in a human. That said, the Centers for Disease Control do emphasize that you should consider having your deer tested if it's harvested in a CWD management area. If you have a deer tested and it does come back positive for CWD, the CDC recommends that you not consume that deer. This is made out of an abundance of caution. We're talking about human lives here, and of course the CDC is going to be very conservative. That said, this disease has been on the landscape for over 50 years out west, and again, no human has been documented to have contracted CWD. Here in Georgia, we've been doing statewide surveillance for CWD since 2002. We have been working hard to keep an eye out for it, but also to try to prevent it from getting to Georgia. We worked with the legislature to prohibit the importation of live deer and carcasses from CWD positive states all the way back in 2005. This rule was further amended in 2022 to prohibit the importation of deer carcasses from any state outside of Georgia. Our law enforcement division has investigated unlawful importations of live deer multiple times over the last 20 years. In every case that we've tested animals that did come in from other states, none of them have tested positive for CWD. We also use a risk-based model now for surveilling our state. If you look at the map on this slide, you'll see those darker red counties, particularly along the borders of states that have found CWD. We collect more samples from there. We collect more samples from areas where we know there's a captive deer facility. And we assess other risk factors, such as unlawful importations, to make sure that we're collecting a sufficient number of samples from those counties to detect this disease at a prevalence of less than 1%. Now that we've found CWD, where did we find it? Our first positive case was part of this routine testing that I just described. It was a 2.5-year-old male deer that was harvested by a hunter right on the Lanier-Berrien County line. The counties that touch a 5-mile radius around this initial positive are included in our CWD management area. This management area may expand if more positives are discovered, but at this point, we've tested additional 24 samples, and the preliminary results are that they're not positive. We hope this trend will continue. As soon as we got notification from the National Veterinary Services Laboratory that we did in fact have a positive sample, we activated our existing response plan. We notified the hunter and the landowner, identified the location of exactly where this deer was harvested, contacted all landowners within a 1-mile radius who had a property larger than 20 acres, and we reached out to area processors and taxidermists. We also, as part of our plan, immediately began public outreach efforts. A press release was done on January 23rd. At the same time, we uploaded a fully updated website with all the information that we could possibly provide for our hunters and landowners and interested citizens. We had a press conference on January 24th. We've done numerous social media posts and answered questions via our comments, direct messages, and emails. We will continue to answer questions and be a source of information moving forward. We've already conducted one in-person public meeting down in South Georgia. We're having this meeting tonight. We will also have in-person meetings in South Georgia on Saturday. We will continue to update our frequently asked questions with answers. Hopefully, any questions you have are already there, but if you have new ones, please reach out to us. We're currently working with landowners to collect additional samples within the 1 mile radius. We will also collect samples from deer removed on crop damage permits and road-killed deer until hunting season begins in September 2025. We're doing this to try and determine the prevalence and geographic extent. We want to know what % of the deer herd is currently positive, and we want to know how far it has spread, so we can update our citizens with that information. Fortunately, while CWD is somewhat easily transmitted, it is not easily contracted. Deer have to have repeated exposures before they come down with CWD. We are going to be implementing a cluster sampling strategy, working with landowners to follow up on each positive deer. We'll be focusing on the immediate vicinity where each positive deer is found. This method selectively targets the deer most likely to have had contact with the positive deer. This is because contracting CWD does require frequent sustained contact with an infected individual or a heavily contaminated environment. So it makes sense to focus on the few deer that are most likely to have had contact with that positive. So between now and deer season, we will continue cluster sampling to remove individual deer most likely to have CWD. We are not using cluster sampling to reduce local deer densities. This is done at the property level. We're not looking to wipe out the deer on that property. We just want to know what the prevalence rate is. We can estimate that with a relatively small number of animals. The removal and sampling efforts are being conducted by landowners and managers in cooperation with DNR. We are not going to use significant herd reductions. It's not a tool we feel is effective for Georgia. And our surveillance and monitoring, as it has always done, will continue to be primarily from hunter-harvested deer, road kills, and deer taken for other reasons, such as crop depredation. So what does the long-term management look like? Our goal is to try to keep prevalence low using cluster sampling and surveillance. Ideally, we'd like to keep it below 5%. We'll continue to increase surveillance to monitor geographic extent, and we will continue to provide access to testing for our hunters. Obviously, we'll increase our testing within the CWD management area, but we've already had an option for hunters who are outside that area to choose to test deer on their own at their own cost outside of the CWD management area. Our goal is to maintain Georgia's rich deer hunting heritage for future generations. If you look at this graph, you'll see a blue line that indicates what happened in another state where they began cluster sampling, but for a variety of reasons had to reduce those efforts and cease them completely. That escalator I mentioned earlier in prevalence is exactly what happened. The prevalence increased, the geographic extent increased much faster than it did in the green line, which is a state that continued cluster sampling over a much longer period of time. They were able to suppress that prevalence rate and keep it below 5%. That is our goal. I want to emphasize that DNR has been planning and preparing for this for over 20 years. Our response plan has evolved over that time as we have monitored 35 other states who have found CWD before we did. Our management will be conducted locally in cooperation with landowners and hunters. It's likely here to stay. It will require continual surveillance and adaptive management over the long term. So how can you help? First of all, don't stop hunting. This is not the end of deer hunting or deer herds in Georgia. This is just something that we have to deal with in the long term. Dispose of your deer carcasses responsibly. If you must remove it from the property where it was harvested, make sure that you take it to a processor or to a taxidermist so that it ends up in a landfill. If you process it yourself, you can bag it and send it to a landfill with regular trash, Or you can consider burying it deeply enough that scavengers can't pull it out onto the landscape. If you choose to continue baiting and feeding on your property, consider implementing practices that may reduce risk, such as broadcasting versus piling bait, avoiding troughs and gravity feeders, or any kind of piling. You want to move these locations so that contamination isn't happening repeatedly in one spot should an infected deer appear. And limit the feeding that you may do or baiting you may do to times when you are actively hunting versus year-round or even for the entire hunting season. If you'd like more information, we have a lot of information now on our website, which is on this slide here. If you have questions or concerns, we've set up a dedicated email address, cwd@dnr.ga.gov. And then we also have our gm.comments email for any recommendations, thoughts, or input you may have relative to hunting regulations. And with that, we'll shift to our Q&A session.
How is it possible for it to jump from one spot to another over an entire state without infecting other deer?
That's a great question. So the question was, if it's so infectious, how does it jump from one spot to another, including across vast distances? So there are a couple of ways that CWD can move long distances. One is obviously in the back of a vehicle, right? So if someone is lawfully or unlawfully, depending on the state, moving live deer from one place to another, because it is not something you can test live deer for, that's one way that it gets from place to place. The other way that it's been documented to get significant distances is a deer itself moving long distances. It doesn't happen very often. Most of the time deer are homebodies, but particularly older bucks will move 60 or 100 miles during the breeding season. They may stay where they go and spread the disease there, or they may eventually circle back toward their original home range. But deer themselves can transport it quite a long distance without necessarily infecting other deer, because they just don't spend very much time hanging out with those deer and having that physical contact repeatedly that is needed to transmit the disease.
Sites, which you kind of covered very deeply.
He's talking about from like, yeah. So the question was, how do we prevent CWD from being transmitted through deer processing sites? And this is going to require that people just dispose of carcasses appropriately. Most of our processors, we already know from surveys, send the discarded carcass parts to landfills, which is a safe way to dispose of these parts. If you're doing it yourself, you want to be sure that you don't take that deer from where you harvested it to some other location and then put those parts out on the landscape. I know some people will put parts out, say for coyote hunting, or to put a camera over it to see what comes in. Don't do that. Don't transport those parts somewhere else. Make sure they end up in a landfill or a good burial pit. And then most of our processors are already using sanitizing methods that will reduce, if not completely eliminate, the spread of these infectious prions. We got a great question about having your deer tested. So if you harvest a deer within the 2-county zone, all you need to do to have that deer tested is either take it to a processor or a taxidermist and let them know that it came from that county, and we'll collect the head from them. You can also drop your deer head off within that CMA, within that CWD management area, at our freezer drop-off locations that we'll have located throughout both counties. All you do there is cut the head off, and if you want to skull cap it, you totally can do that and take the antlers with you. There'll be a kit there to bag that head, drop it in the freezer. We'll have it tested, and we'll get those results back to you as soon as we have them. Best case scenario, it takes a couple of weeks. It's usually more like 4 weeks to get those test results back. But we will notify you what the results are either way if it's harvested within the CMA. If you harvest a deer from outside those 2 counties, but you'd still like to have it tested, all you have to do is call your local game management office. You can find that phone number on our website, and they will walk you through the process of getting a sample collected. Multiple ways. We just need the head from that dead deer that's still fresh. We can collect that sample for you, and you can pay for that sample through our licensing system. It's $45 per sample for a deer outside of the zone. But within the zone, we will absorb those costs and get those results to you as quickly as we can. So right now, we do not anticipate making any changes to the regulations for the CWD management area. So Lanier and Berrien counties, we're not proposing any sort of feeding or baiting prohibitions for those counties. And the reason for that is that we don't have clear science that says if you stop feeding and baiting, it will prevent the spread. Feeding and baiting has been something that's been very politically contentious in Georgia. We know from other states that these bans are difficult, if not impossible, to enforce on a large area. And would rather that if folks do choose to feed and bait, that they consider those practices that will probably reduce the risk of spread. But we just don't know that reducing, much less eliminating, is going to do anything to prevent the spread of CWD, and it's certainly not worth losing the support of our hunters and landowners. So relative to the use of real urine lures, again, there's no evidence to suggest that the use of urine lures spreads CWD. Urine lures have been used all across the United States for a long time. We do suggest that if you're concerned that you consider artificial urine lures, but given the number of exposures that a deer would need, it just doesn't appear that a deer, even putting its nose into a spot where you've put one of these urine lures, is going to provide enough infection for anybody to pick up the CWD. So relative to whether or not we've found any additional positives in the area, we are currently working with landowners in that area. We've collected an additional 24 samples to date that have been sent to the lab, and thus far those have not come back as positive. Great question about adding medication or trying to treat deer to prevent or cure CWD. At this point, there's no vaccine, there's no treatment, there's literally nothing that you can do once a deer has CWD. There's nothing that would prevent them from getting CWD. Our best prevention has been prohibiting the movement of live deer and bringing in infected carcass parts, and moving forward, we'll continue to focus on trying not to move carcass parts and live deer. But there's no vaccine, there's no medication, there's no cure, there's no preventative, unfortunately. So what should you be looking for if you're hunting in an area that has CWD? Unfortunately, these deer look perfectly healthy. You may see a really nice buck out there, and we want you to go ahead and harvest deer just like you normally would. If you see a sick deer, notify us, just like we've always asked people to do. But unfortunately, until those last stages, a deer is going to look perfectly normal. There are other injuries and diseases that have similar symptoms. So if you do observe a deer that's clearly suffering from some sort of injury or disease, while it's most likely not CWD, please do call and let us know, and we'll work with you to try to get that animal tested. So brain tanning deer hides is a great question. If you're outside of the CWD management area, carry on as normal. If you're hunting within those two counties, I would recommend that once you remove that brain, make sure that you take that deer for testing. Submit that head for testing through one of our freezer locations or by contacting your local region office. You can proceed, you're not going to get CWD from it, and as long as you're not giving that hide to another deer, there's no evidence that CWD infects anything other than deer in our part of the world. So brain tanning should be a perfectly safe activity, but it would be good for you to go ahead and have it tested so that you know. So if you're hunting on a property within the CMA, so in this case within Berrien or Lanier counties, we do recommend that every deer harvested be tested. It should be fairly easy to drop those heads off at a freezer location for testing, and then when you get those results back, you can decide, whether or not you want to keep that meat or discard it. But we would recommend that you test every deer, just so that you know for certain whether or not that animal tested positive or not. Okay, so relative to this CWD passing from a doe to her unborn fawns, research was recently conducted to examine that very thing. And the answer is yes. They have found infected does can and do pass it to their fawns. It's not 100%, but you can definitely have an infected doe who may have infected fawns, or she may not, but it can be transmitted that way. So how long is it from when a deer contracts CWD to when it would die of CWD if it didn't die of other causes? And that can be up to 3 years. 18 to 30 months is the average incubation period from when that deer gets it to when it dies. Once they start showing symptoms, they only last a matter of a few weeks to a couple of months before they will ultimately die from it. And yes, deer do die directly from CWD. So we had a great question about contaminated environments. And so there's still a lot of research being done on this, but plants and soil do hold on to these infectious prions. And so we don't really know what happens when a deer eats vegetation that is contaminated with CWD prions, but at least in theory, they can get it from eating contaminated vegetation, and it will be held within that vegetation that's growing in that contaminated soil or that has been contaminated directly by bodily fluids. So relative to processors processing all the deer that come into their facility, we want all of the deer that come from those 2 counties to be tested. And we do pay processors as part of our routine surveillance process now to save heads for us or collect samples for us that we test as part of our routine surveillance. And so, yes, I mean, we won't pay to test all that come into a processor, but we will pay for all the ones that are from these 2 counties. Another great question, can prescribed fire destroy prions in the environment? Unfortunately, most prescribed fires, if they're done right, are too cool to destroy prions. So prions require very high heats to destroy them. You're basically denaturing a protein, which requires temperatures over 1600 degrees. So unless it's a wildfire completely out of control, prescribed fire is not going to do anything to really reduce the amount of prions in the soil. Obviously, it can remove infected vegetation, but those prions are still going to be there in the ash and in the soil. So certainly testing is going to be a significant cost for the agency moving forward. That's going to be part of our cost of doing business. We do charge $45 for the cost of an individual test for a deer outside of the zone. That is for an individual test to go to the diagnostic laboratory. We get a slight discount for our batch processing, but there is not only the cost to the diagnostic lab to run those tests, but of course there's the cost of paying processors and taxidermists who collect those for us. Our staff collect an enormous number of samples throughout the year, and obviously there's a staff time cost there, driving around to processors and taxidermists and picking up those samples. And that is one of the reasons that we've worked hard to keep CWD out of Georgia, is that is a cost that we will have to bear that comes from, other things that we would like to support. So, question about the safety of consuming venison, and that is a good one because, as I mentioned earlier, the Centers for Disease Control do recommend testing deer taken from CWD positive areas, and if a deer tests positive, don't consume the meat. That said, as I mentioned earlier, this has been on the landscape for a very long time. People inadvertently eat positive deer every year out west. And no one has ever gotten CWD from consuming deer meat. The other good news is that it does not appear to transmit to anything other than members of the deer family. Other animals out in the wild are obviously eating CWD-infected deer and are not contracting CWD. So as far as feeding it to pets, shouldn't be a problem. If you choose to get your deer tested and it comes back positive, I would encourage you to read all the information on our website, do your own research, or you can take the 100% safe route and go with the CDC recommendations and discard that meat. But there's no evidence that CWD infects people, pets, or livestock. We're getting some really great questions, you guys. Keep them coming. This latest question is home testing kits. Unfortunately, it does not look like there's going to be any sort of home testing kit anytime in the foreseeable future. The tests right now for CWD prions require some pretty elaborate high-tech machinery to detect those prions. So I don't foresee there being a home test anytime in the near future. Right now, there's still no approved test for live deer, so it will probably be a while before there'll be anything that you can do at home. Now that said, if you look on the internet, you can find anything, and there are companies that advertise CWD testing for deer meat. I would urge you to do your homework if you're considering using one of those companies. Those are not federally approved food quality tests. So what about mineral licks? Another great question. Like feeding and baiting, the jury is still definitely out. There's not been any quality research done to determine whether or not the contamination that happens at a mineral lick, whether it's an artificial or a natural mineral lick, if there's enough prions deposited there to be transmitted to another deer in sufficient doses to cause CWD. That said, I would certainly use the same logic as we're recommending with feeding and baiting, which is consider not doing it at all. And if you are going to put out mineral licks, consider changing up that location to not continually be potentially building up prions in the soil if it's in a CWD positive area. So of course we want people to notify us if they see a sick deer, a deer that's not acting right. As far as dispatching that deer, please contact the local region office for law enforcement and let somebody walk you through what you're seeing, whether or not it's safe to remove that deer. Do you need a permit to remove that deer? But we definitely, if you observe a sick deer, we want to know about it, and we want to work with you to try to collect that deer if at all possible. So relative to WMAs within the CWD management area, so in this case, Grand Bay WMA would be an example of that. There will not be mandatory check stations or sample submission anywhere. Now, if we have a staffed hunt at a WMA, we'll certainly be collecting samples in those situations. But no, there's no mandatory station, but we definitely want folks to consider submitting those samples, and we will get them tested for you. So if you have any additional questions, we're happy to take those. If you think of questions later regarding CWD, please do email our cwd@dnr.ga.gov information email. But I'd like to take this opportunity to express my gratitude to our incredible staff who've been working tirelessly on our CWD response plan since the early 2000s. The dedication of our staff and their commitment to managing this situation is truly appreciated. I want to also thank our field staff and law enforcement teams whose efforts in connecting with local communities and hunting clubs to gather additional samples after the season have been crucial to our surveillance efforts. As we move forward, our primary goals are to increase surveillance and keep prevalence levels low. I'd like to reassure everyone that this is not an end to deer hunting in Georgia. Once again, thank you all for your time and participation tonight. You guys have asked some really good questions. Please take care and have a great evening.